One of the key topics that was discussed during this executive board is the outcome of the ICN2. The ICN2 is the second international conference on nutrition, which is a conference jointly organized by the World Health Organization and the Food and Agriculture Organization last November in Rome to address the challenge of global malnutrition. And PHM, along with other civil society organizations and social movement, closely followed this process. And we were also quite disappointed by some of the outcomes of this process. In particular, we were disappointed by the fact that the recommendations contained in the final documents of this conference were non-binding, so voluntary. And during the discussion at the executive board, PHM was also able to deliver a statement, and in this statement we particularly focused on the issue of conflict of interest, and we asked for caution, in particular in relation to multi-stakeholder platforms, because where such platforms include private sector participation, this could lead to mission shift and also prevent the consideration of regulatory or fiscal strategies. And I think that one of the most thorny moments of the discussion during the executive board was a proposal made by Italy for a review, asking for a review of the procedures for the development of WHO's technical guidelines, in particular the guidelines on nutrition, so related to also the implementation of the outcomes of the ICN2 conference. And some observers suggest that there is a hidden agenda, because this proposal could provide opportunities for stakeholders linked to the junk food industries to interfere in the process of guideline development, and so give them an opportunity to lobby against these guidelines. So since PHM recognizes the importance of protecting the process of guideline development by the other interests, by the influence of other interests, I think that PHM will try to closely follow this issue also in the next few months.
So People's Health Movement have been tracking 3 agenda items on the WHO's Executive Board in relation to medicines policy. One of those items is called as a report of the Member State mechanism on spurious, substandard, falsified, falsely labelled counterfeit medical products, otherwise known as SSFFC. The report of the Member State mechanism ultimately shows that Member States have still not come to a consensus after more than 4.5 years of negotiations on how to define the problem of poor quality or fake medicines. So PHM was really urging Member States to drop the term counterfeit from the title SSFFC, because counterfeit in the World Trade Organization, and which a majority of Member States are a party to, refers to the infringement of trademarks or intellectual property. And as long as counterfeit is used in this Member State mechanism around public health issues of quality of medicines, it allows the pharmaceutical industry and other actors to push Member States, in particular in the developing countries, to ratchet up their enforcement of intellectual property rights under the guise of ensuring better quality medicines.
The proposal of the WHO was a draft resolution that has been approved, and it was about the access to surgical care worldwide and to anaesthesia services. PHM supports this report and also proposes for territorially improvement of the healthcare system, and proposes also to develop the use of health personnel that has to be trained and in a way that is specific and is suitable with the situation and the rural area and the rural healthcare system, and also asks for an implementation of the healthcare system that has not to be made of vertical programs.
Malaria was also part of the Millennium Development Goals, which were valid till this year, and now they discussed a post-MDG strategy. So what should be done according to Malaria from 2016 to 2030? And their plan is to decrease malaria-related mortality and morbidity by 90% till 2030. And they're trying to do this through a bunch of vertical programs like chemo prevention and vector control, treatment, and so on. The problem is what we see health system strengthening is not mentioned at all in this resolution, also not in the global strategy plan. And that is actually a huge problem because they just put new vertical programs on an existing health infrastructure in all these countries. And we think that it won't work really good. And also issues like links between vector control and land using are not addressed in the resolution. The same as addressing social determination of malaria mortality or morbidity, especially in poor regions. So we think actually the new resolution lacks of really important issues like health system strengthening to really deal with malaria in the next years.
We spoke at this executive board about women and health, and actually we spoke about it because we are now 20 years after the United Nations Conference on Women, and health was one of the topics where the countries should have taken action. The Secretariat of the WHO provided us with a report on the progress on women and health that was made since this conference. From this report, it's actually clear that the progress that was made was not enough, that there is still a lot that has to be done, and that the progress that was made was very unequal. So actually almost every country acknowledged that the progress was not enough and that they have to take more actions. But as BHM, we say that there are already a lot of statements, policies, and declarations made on the topic of women and health, and we want that countries are accountable and take effective actions on this issue. We need a publicly funded, strong primary healthcare system, and this is the only way to ensure accessibility, equity, and quality of care.